Welcome to Module 2 of Advanced ECG course, and this module is about interpreting 12-lead ECG by using 7-step approach. The learning objectives of this module includes to review checklist and step-by-step interpretation of ECG, to learn and discuss each step of ECG interpretation, and in between we'll have two exercises: rate determination and rhythm analysis. So this is the checklist, and there are many ways to interpret the ECG, but in this course we are going to apply this checklist as a stepwise approach. Step 1 is the rate. The rate can be normal, bradycardia or tachycardia. Then the rhythm. When you are going to interpret the rhythm, you have to go through these steps, whether the rhythm is regular or irregular. Then the P wave and its relationship with the QRS complexes with 1:1 ratio, QRS duration and PR interval. Then comes the axis. Axis can be normal. There can be left axis deviation, right axis deviation, or extreme right axis deviation. The next step we are going to talk is about the hypertrophy, and in this one you will see the atrial hypertrophy and ventricular hypertrophy. Then the interventricular blocks, we are going to review the right bundle branch block and left bundle branch block and fascicular blocks and the ECG findings associated with these blocks. Then the infarction, and we'll interpret the ST segment first with we'll see is there any ST segment elevation, then ST segment depression, T wave inversions, Q wave and R wave progression. And final step is the miscellaneous. And in this step we are going to cover the QT interval, U wave, J wave, PR segment, lead misplacement and artifacts, and we'll look all the leads, especially AVR and calibration and speed. We have to take care of this one as well. And we should correlate all the findings on the ECG with the history and physical examination to reach a proper treatment decision. Here I'm going to apply the 7-step approach on this ECG. The purpose of this small segment is not to teach the whole ECG, but just to sensitize how we are going to apply this checklist on an ECG. This ECG belongs to a 50-year-old man who is suffering from the heartburn. Okay, so look at the ECG as a whole. Okay, sometimes from the distance you may get a striking abnormality, and in the upper part there are some information about this patient, and even there is a computer-based auto reading of this ECG. These are the 12 leads. In the upper part, lead 1, 2, 3, AVR, AVL, AVF, and the 6 chest leads. On the bottom there is a rhythm strip. And also if you see on the lowest part of the ECG paper, there are calibration signals. The speed is 25 millimeter per second, and the voltage is 10 millimeter per millivolt, and this is the voltage calibration signal. You can also have a look on the AVR, which should be negative in the normal ECGs. If this is abnormal, so definitely you are dealing something wrong. So after this just overview of this ECG, let's apply the first step. So what's the rate here? There are many methods, and we are going to cover soon in the coming slides. The rate here is approximate 80 beats per minute. What's the rhythm here? So there is a P wave followed by the QRS complex and T. So these are the normal shape P wave. So this is sinus rhythm. As the heart rate is within the normal limit, so this is your normal sinus rhythm. Then what's the QRS axis here? So to check the axis, you have to look at the lead 1 and AVF. If both are positive, your axis is normal. Then you have to look for the hypertrophy, the atrial as well as ventricular hypertrophy. As far as the atrial hypertrophy is concerned, you have to look at the P wave in lead 2. If it's tall, this is right atrial hypertrophy. If it's broad, it's left atrial hypertrophy. But in this ECG, it looks normal. For ventricular hypertrophy, you have to look in the chest leads. For right ventricular hypertrophy, you have to find the R wave in V1, which is not seen. And for left ventricular hypertrophy, you have to look at the S wave in V1 or V2, whichever is the deepest, plus the R wave in V5 and V6, whatever is the tallest, and then combine the voltage of these two ECG. If it's more than 35 mm, it's left ventricular hypertrophy. But in this case, in this ECG, it seems to be no left ventricular hypertrophy. The fifth step is there any bundle branch block here? So to see a bundle branch block, you have to look at the lead V1 and V6. If there are wide Kuros complexes, so there are chances that the patient has bundle branch block, but here no bundle branch block. Then you have to look at the ST segment elevation and ST segment depression and T wave changes. There is no ST segment elevation, no ST segment depression, and no abnormal T wave inversions. Is there any abnormal Q wave? Subnormal Q wave signifies the old infarction. So we can't see any abnormal Q waves. Is there any R wave progression? Poor R wave progression. You know, the R wave progresses from V1 towards V3 and V4 and V5, and it keeps on increasing in size. So sometimes in certain conditions like intraseptal myocardial infarction, left bundle branch block, the R wave is progressed poorly. But in this example, there is a nice progression. Anything else interesting? The QT interval seems to be normal, less than half of the RR interval. No U waves, no J waves. There is no lead misplacement. So how you are going to read this ECG? This ECG shows normal sinus rhythm with the rate of 80 beats per minute, a regular rhythm, no axis deviation, no atrial or ventricular hypertrophy, no bundle branch block, and no evidence of ST changes. So my interpretation is this is a normal ECG. Okay, so after this brief sensitization, how to read an ECG, let's go through this stepwise approach by going through each step one by one. So first step of ECG interpretation is rate determination. So normally what happened on the ECG paper, the machine itself, this computer itself reads the heart rate, which is the exact heart rate which the patient's heart is going through. But whatever we are reading, being a healthcare professional, we are reading the approximate heart rate. So there are different methods of calculating the heart rate. One is the sequence method, other is the large box method, and third one 6-second method. So these are our learning outcomes, and in the end we will practice these different methods. So for sequence method, it's very important to look at the R wave that falls on a dark vertical line. You see on the ECG paper there are dark line and thin lines. There is thick lines and thin lines. So you see which R wave falls on the dark line. Just remember, mark this line, and then number the next 6 consecutive dark vertical lines as 300, 150, 100, 75, 60, 50. Okay. So you identify the R wave which falls on the thick line and then mark the next 6 thick lines as 300, 150, 100, 75, 60, 50. So you have to remember these numbers, or you can break down into two parts: 300, 150, 100, 75, 60, 50. Now you see where is the next R wave. Like here in this example, this R wave falls on the thick line and the next R wave is here. If this next R wave is here, the heart rate will be 300. If it's here, it will be 150. If it's on this dark line, the heart rate will be 100. If it's on this dark line, the heart rate will be 75. But this R wave falls between 75 and 100. So our heart rate is between 75 and 100, or approximately 85 beat per minute. Let's apply the sequence method here. And it's very important to remember that sequence method is applied for those rhythm strips which are regular. Regular means the distance between the two R waves is the same. Like this is a regular ECG. So this R wave falls on the thick line, and see where is the next R wave. Next R wave is here. So if it's here, heart rate is 300. If it's here, 150, 100, 75. So heart rate is between 75 and 100. So approximately 80, 85. Another method which can be used to calculate the heart rate is large box method. So what to do in this method? Count the number of large boxes between the two consecutive R waves and divide it into 300. So again, this method is also applicable if the rhythm is regular. Like here, this rhythm is regular. So look which R wave falls on the thick line. For example, the first one, this R wave falls on the thick line, and see where is the next R wave. It's here. So how many big boxes in between? 1, 2, 3, 4. So your heart rate will be 300 divided by the 4. So it's a 70 beat per minute. There is another method, small box method. In here you have to count the number of small boxes between two consecutive R waves and divide into 1500. Right? So you have to count the how many small boxes, like between this R wave and this R wave, these are 18 small boxes. 1500 divided by 80, again it will be the 70, approximate 70 heart rate. But this is a time consuming, and commonly we don't use in routine clinical practice. But important thing is this is accurate, and this is also used in case of rhythms which are regular. The third method is a 6-second method. A 6-second method is used if the rhythm is irregular. It can also be used for the regular methods, but commonly we use this one in case of irregular rhythms like atrial fibrillation. So let's apply this methods here. So for this one, on the ECG paper there are sometimes marking, but here on this paper there are no markings here. Like here, this one, from here till here, it's a 6-second. But if you're not sure, then let's see how to calculate the 6 seconds. So 5 big boxes is equal to 1 second. So 15 big boxes is equal to 3 seconds, and 30 big boxes is equal to 6 seconds. So let's see where are the 30 big boxes. If we start from here, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19. Till here are the 30 big boxes. Okay, and we'll see how many R intervals in these 30 big boxes which are equal to 6 seconds. So here if you see 1, 2, 3, 4, 5, 6, 7, 8. So there are 8 RR intervals in 6 seconds or 30 big boxes. So in 6 seconds, there are 8. So in 60 seconds, which is equal to a minute, so this will be number of R wave in 6 seconds multiplied by 10. So 80 will be your heart rate. Let's apply the different methods to calculate the heart rate in this rhythm strip. So this rhythm strip is regular. So all these three methods can be applied: sequence method, large box method, and 6-second method. Let's apply all these methods here. So sequence method. So this R wave falls on the thick line, and the next one is here. So 300, 150, 100, 75. Between 75 and 100, approximate 80 heart rate. You see the large box method. How many large boxes between the two R wave? 1, 2, 3, and 4, 3.75 something. So heart rate is again approximately 70 beats per minute. So this comes when you divide 300 multiply by 3.75. And then the last one is the 6-second methods. You have to calculate the 30 big boxes, which is equal to 6 seconds, and see how many RR wave are here. So from here till here are 6 seconds, are 30 big boxes, and number of RR 1, 2, 3, 4, 5, 6, 7, 8. 8 times 10 is equal to 80 heart rate. All right. So now you have learned the three methods of calculating the heart rate: sequence method, large box method, and 6-second method. Sequence method and large box methods are used for regular rhythm. The 6-second method is used for irregular rhythms. Okay. So look at this rhythm strip and let's see which method is applicable here out of these three methods: sequence method, large box method, and 6-second method. As this is regular, so we can apply any of these methods. So if you use this 6-second method, so heart rate will be 300, 150, 100, 75. So it's between 75 and 100. So it's close to, like, for example, 90, 80, approximate 80 beats per minute. You can also use the large box method. So see the how many large boxes are here: 1, 2, 3, 4. So 300 divided by 4 is equal to 70, or even the 6-second method you can also apply here. So let's see which method is you can apply here. So sequence method, if you use sequence method, so 300, 150, 100, 75, 60, 50. So after 50 is a problem here. So it's advisable not to use sequence method if the heart rate is really slow, like less than 50. So here the best method if the rhythm is regular is large box method. This one, large box method. So see by the large box method, 1, 2, 3, 4, 5, 6, 7, 8, 8.5. So 300 divided by 8.5, so it's like close to approximately 40 beats per minute is heart rate, even less than this. Look at this rhythm strip. Again, this is regular, so any of the method you can apply. So for example, the large box method, which is the most commonly used method and most favorite method of healthcare professionals. So if you see this R wave falls on the thick line, so 1, 2, so 2.5. So 300 divided by 2.5, approximately 120, 125, 130 beats per minute. So you can apply the sequence method as well, and you can apply the 6-second method as well here. Look at this rhythm strip. This rhythm strip is irregular. You see the distance between the two RR distance is not the same. The RR intervals are not equidistant. So here sequence method is not applicable. Large box method also not applicable. So the method which can be applied here is 6-second method. So how to apply this one? Just calculate the 6 second. The 6 second are equal to 30 large boxes. So from here till here are 30 large boxes. On ECG paper, sometimes there are marking after every 30 seconds or 50 seconds. From here till here are 3 seconds, and till here are the 6 seconds. So 15 large boxes, 3 seconds, another 15 large boxes, 3 more seconds. So total 6 seconds. So this is a 6 second strip where there are 30 large boxes, and how many RR intervals? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. So 15 times 10 is the 150 is heart rate. Look at this rhythm strip. Again, this rhythm strip is irregular. So you cannot apply the sequence method. You cannot apply the large box method. So only method you can apply is the 6 second method. So see the how many RR interval in 6 seconds. So 6 seconds are 30 big boxes, which is, this is a 6 second strip. So you can calculate the number of RR intervals: 1, 2, 3, 4, 5, 6, 7, 8. 8 times 10 is the 80 heart rate. Look at this rhythm strip. This is mostly regular, so you can apply any of the above methods. So sequence method, if you will use, so this falls on the thick line, 300, 150. So heart rate is approximately 150. Large box method, so 300 divided by 1 and 2 big boxes, so approximately 150. And then the 6 second method, from here till here are the 6 second: 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. 14 times 10 is the 140 approximate heart rate. Look at this rhythm strip. So here it's a challenging strip, but if you see, if we'll take this initial part, okay, as a separate rhythm, and the later half as a separate rhythm, then it's easy to calculate the heart rate, because this ECG shows a specific rhythm, which is the SVT, supraventricular tachycardia, and here the patient might have received some intervention like adenosine, and then the later it starts another slow rhythm. So by sequence method, if you see the initial component of this ECG, it's 300, 150. So heart rate is between 150 and 300, approximately 180, 190. By large box method, this is again 300 divided by 1.5, so 180 approximately. But if you look at the second half, it's slow here, and it's slightly irregular also. So it's difficult to apply the sequence method or large box method. So let's apply the 6 second method. So if we start from here, for example, from here onwards, so 6 seconds means 30 big boxes, but how many we have? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. From here till here are 15. So we don't have a complete 6 seconds, but we have 3 seconds strip. So how many RR is 1 and 2 R? So here instead of multiplying with the 10, we'll multiply by the 2. So 2 RR intervals times 2 is the 40 is heart rate. Now again look at this one. This is irregular, so 6 second method. So by using this 6 second method, you from here 1, 2, 3, 4, 5, 6, 7, 8. So this is a 6 second strip, and see how many RR interval: 1, 2, 3, 4, 5, 6. 6 times 10 is the 60 is your heart rate. If you will just take the 3 second strip, then 1, 2, and 3 RR interval. So 3 times 20 is again the 60 heart rate. So but if you have a 6 second strip, better apply the full 6 second. So here this is a regular rhythm. So you can apply the sequence method, you can apply the large box method, or 6 second method. Any method you can apply. So by using the sequence method, it will be, this falls on the thick line, 300, 150, approximately 150 heart rate. By large box method, 300 divided by 1 and 2 big boxes, again 150. And by a 6-second method, this is a 6-second strip, so 1 2 3 4 5 6 7 8 9 10 11 12 13 14 140 approximate heart rate. So thank you very much, and let's proceed to the step 2, which is about the rhythm analysis. So in this first step, we have learned the 3 methods of rate determination. These includes the sequence method, large box method, and 6-second method. Sequence method and large box methods are used to estimate the heart rate in regular rhythm strips, but 6-second method is applicable to the irregular the rhythm strips. And the best heart rate and accurate heart rate is seen on the ECG paper, which is calculated by the ECG machine.